Welcome to New Hampshire's Business. I'm Fred Coker. The face of healthcare is changing quickly and dramatically, but the question is, are these changes good or not, and will they be permanent? Let's look at the pandemic impact on health insurance coverage. You can see more workforce adults in the U.S. and New Hampshire are uninsured, 5.4 million more in the U.S. from job losses February to May, and 29,000 more in New Hampshire, or 43% increase for a total of 96,000. Then what about the change on how we access our health care? Take a look at this. The changing face of healthcare, reimbursement, perhaps, for telehealth and virtual visits, and more access and affordability with this whole digital transformation that we're going through. With me to talk about this is Dr. Elliot Fisher of the Dartmouth Institute in Hanover, who is an epidemiologist and a public health researcher and a professor there at the Institute. He warns that the number of uninsured could go up. Welcome, Dr. Fisher.
Hey, wonderful to be here.
Nice to have you. We could go for an hour on this subject, but let me focus first on the uninsured. You say this could get worse. How so?
Well, we know unemployment could continue to rise if the pandemic continues to worsen, and there are more job losses. Half of the American public depends on their employers for their health insurance, and when you lose your job, many people lose their health insurance. Some are covered by their spouse, but many people lose their health insurance.
Yeah. And then, of course, Obamacare. We have an exchange in New Hampshire for Obamacare, which is the option, I suppose, the number one option for people who are uninsured to go to.
You know, I think the most important thing for people who lose their insurance through their jobs is to check quickly into the availability of other forms of insurance. And the exchange is a very important option because you only have 60 days after losing your job to sign up for that insurance, which is highly subsidized for everybody.
Right. Access to healthcare is going virtual, and now with the use of telehealth technology, are we prepared for this kind of change in our healthcare, especially in terms of rural areas that don't have a lot of broadband?
No, but there's I think the transition to telehealth is tremendously helpful to improving the accessibility of healthcare. During a pandemic or not, if you're in a rural area, who wants to drive 2 hours to a hospital for a 15-minute appointment that could have been done by the telephone? So I think the public is going to demand continued access to telehealth or other kinds of digital services like texting or emailing with your provider. It will stay with us.
This is healthcare changing for the better or worse?
Both.
Right.
The way it's changing for the worse is we have now many, many more uninsured than we did, and we still had millions, tens of millions of uninsured. So that's a change for the worse. I think affordability is going to continue to worsen. Rising healthcare costs in the United States are driven by rising prices. That is, the monopoly power of many providers allows them to raise the prices, and this is a problem well recognized throughout the country. That could be worsened by the pandemic as small independent practices are snapped up because they can no longer stay open and large systems buy them up, increasing the monopoly power and raising prices further.
Just briefly, what concerns you the most as you do your research into healthcare these days?
Well, I think that the United States is unique. It's the highest cost in the world and the most inequity and the most uninsured in the world. So what troubles me the most is whether we can address the underlying causes of the problems we've faced for the last 20 years, and none of them are getting better.
Dr. Elliot Fisher of the Dartmouth Institute in Hanover, thank you.
Thank you very much.